Alright, so we are going to do the NG tube placement. We already have his bed in the correct working order. He's in semi-followers. I removed the pillow. If he's unconscious, we want at least 45 degrees. We've checked the MAR for our reason for doing the decompression. I believe it's abdominal surgery. We don't want the buildup of gastric secretions. We want them to come out. We have done our abdominal assessments, and we have inspected the nares, and we're going to use the right nair. It's bigger and will work better. We've also provided patient education on how it's not going to be comfortable. His eyes are probably going to water, and that when we reach the pharynx, he's going to need to put his chin to his chest and swallow and drink water. And then as he's swallowing, we'll progress the tube forward. So the supplies are the Chuck's pads, our piston tray, our tube. I got a little stopper, tape, pH tape, the safety pin, rubber band, mannequin lube. This for irrigation when he comes back, and I don't have a tape measure, but we can pretend. So, okay, I'm ready to start the skill. I am going to wear gloves from the beginning to the end because I like gloves. I've also educated my patient that if he can't stop coughing or gagging and start showing signs of respiratory distress, like shortness of breath, we will stop the procedure and remove the tube, as we do not want him to have that in his lungs. So I'm placing his Chuck's pad there. I have opened my piston tray. I'm going to remove this little pad so I can use a spray on this. And we're removing this because that is what we'll get our gastric secretions in. We'll put that there. Right. So we'll say I've opened this from the package. This is our mannequin lube. Spray that. Okay. I'm also going to have, before I put in, I'm going to have a piece of tape ready so that I can loosely tape it to him. Alright. So, I suppose before I did this I should have measured it. So you measure from nose to earlobe to xiphoid process. Now in our patient, that is about 46 centimeters. Right. So he's going to have his head extended back, hyperextended, so the neck's extended. I'm going to tell him to take a deep breath. We're going to go in. And in a real patient, we would add about 5 inches. We'll go from here saying we've reached the pharynx, this mannequin. He would tip his head forward, and I'd maybe have a helper, and he would sip and swallow, and as he's swallowing, I would continue to progress the tube. We're going to leave his head back for the sake of it being easier on the mannequins to insert. We have met some resistance, and in that case I would get a flashlight, tongue blade, look in there and see if it's curling or coming out. It's not. It's going down. We reached our 46 centimeters. I'm going to loosely tape this to here. Place this in here. I'm not going to take the gastric paper out, but mannequin lube. We would put it in, withdraw, kink our tube, put in out our pH paper. Our pH paper is showing that it is a 3. I'm going to go ahead and plug that up. I'm going to attach to his right side, because he's right-sided, this to his gown. take some tape. Make little pants. His nose. And then we're going to wrap it around. And then this one will go the other way to create a braid. So it's easy to come off. Our loose piece of tape that was keeping it in place over here, I'm going to cut across. Right. Now before we send him to x-ray, I'm also going to measure the length of the exposed tube and document that. So we can go ahead and say that he's come back from x-ray. So I'm going to, once again, measure the tube and see if it's still the length that it was before it went to x-ray. And also, I'm going to grab my pH paper, which is still right here. I need this piston to remove a few gastric secretions to check it. But remove this. I'm pouring in my solution to use for our 30 ml flush irrigation. Alright, so he's back. I'm going to kink his tube, remove his plug. We put the Chuck's pad under him again, and we are going to pull back. We got a little bit of fluid. I'm going to kink this. I'm going to measure my paper. It is the correct pH. We have connected him to his suction apparatus, and since I know we won't get stuff all over the place, I'm remeasuring his tube. Straighten that out. He's connected to suction, so I would turn suction on to low intermittent suction between 25 and 75, and we want to have this up here so it's not below the stomach. We're going to ask him if he wants any oral health hygiene done, reassess his bowels, see if he needs anything, put his bed in the lowest position, and collate within reach, and clean up our mess. That's the end of the skill.